All right, welcome back to the Surgeons Roundtable discussion here. We have a question for Dr. Earle. BBL versus hip dip fat transfer. What's the difference and which option is best?
All right, so there's a question that comes up simply because there's a little bit of confusion, right? But overall, we're talking about very much the same thing, just how much fat we're adding to what areas, right? So BBL is the combination of a liposculpture 360 with the fat transfer, which is typically to the buttock and the hips. And so if we're talking just about the hips, then of course we're just focusing on that one area. The nice thing about just focusing on the hips is that we can add that on though to other procedures, say for example your mommy makeovers or tummy tucks as well.
Absolutely. It just comes down to people's perception of what the procedure is. It's really the areas that's included with it, and it's a great option to do. The hip dip is the only option you can get when it's combined with other procedures where the recovery requires you to be sitting on your bottom because you don't want to transfer fat to an area where you're going to be sitting on it long term during the recovery.
Yeah, but I always, if you're doing a 360 and a BBL, and I've had a lot of patients, I don't know if you guys agree with me, but I always tell the patients, I'll focus more in the hips, but I always like to complement a little bit to the buttock. So you have a good 360 kind of projection, and that's not only like projection on the hips without that complement on the buttock. I think it's great for tummy tucks and mommy makeovers because, like you mentioned, the recovery part. But if you're doing this like a BBL, I always kind of add a little bit to the buttock to get that 360 view.
Go ahead and smooth out that transition.
Yeah.